Welcome everyone. Thank you for joining us today. I'm Nicole Dupuis, CEO of the Windsor-Essex Health Unit. Today we are reporting an increase of 20 new cases of COVID-19 in Windsor and Essex County. 7 are community acquired, 6 are close contacts of confirmed cases, 1 is travel related, and 6 cases are still being investigated. We have had 16,958 cases since the beginning of the pandemic. 79 people are active at this time, with 32 of our active cases being a variant of concern. To date, 2,047 preliminary or confirmed variants have been identified in Windsor-Essex County. 3 people are currently in the hospital and 1 person is in the ICU. Unfortunately, we are reporting an additional death today. A woman in her 70s from the community has passed away due to COVID. We have lost a total of 436 people to COVID in Windsor-Essex County. There are currently 3 active workplace outbreaks in Windsor-Essex County. Now for a vaccine update. 289,947 people have received at least 1 dose of COVID-19 vaccine. Overall, 76.4% of adults 18 years of age and older in Windsor-Essex have received at least 1 dose of COVID-19. 256,746 people in Windsor-Essex County are now fully vaccinated. So for 12 plus, that's about 67.6%. All vaccination clinics are offering same day and walk-in appointments. Please do not delay. If you haven't received your first dose, book today. If you are due or overdue for your second dose, book today. Most people experience no or very mild side effects from vaccination, mainly a sore arm. If you have questions or are unsure, talk to a trusted health professional or call us at the Health Unit. To book an appointment at a mass vaccination site, please visit wevax.ca or call 226-773-2200. Lastly, as parents and guardians prepare to get their children ready for the upcoming school year, it is important that in addition to ensuring their children have their COVID-19 vaccine, if they are eligible, that those born in the year 2006, 2007, 2008, and 2009 also receive their vaccines for hepatitis B, meningococcal disease, and HPV. Students can receive these vaccines through their family doctor, nurse practitioner, and other community healthcare providers, and are encouraged to do so. For families unable to access these vaccines through a community healthcare provider, the Health Unit is hosting a series of student immunization clinics at Mackenzie Hall in Windsor, located at 3277 Sandwich Street West. These clinics will be by appointment only, beginning on Wednesday, August 11th, and will be continuing Monday through Friday for the remainder of the month of August. Families can book an appointment for their child by visiting our online booking tool at wechu.org/online booking, or by calling the School Immunization Helpline at 519-258-2146, extension 1222. I will now turn it over to Dr. Ahmed, our Medical Officer of Health. Thank you.
Good morning. We'll just jump right into our epi summary for this week. Before we start to look at the local data, just a global picture where things are. And as we can see, the UK and Spain have seen a huge increase in the number of cases. They're starting to show some decline in the daily reports. But on the other hand, France, US, Italy, Japan, including Canada, are seeing an uptake in the number of COVID-19 cases in the country, and a lot of these cases are attributed to the Delta variant, as we have seen that almost 100% of the cases in Germany, UK, and other countries are as a result of Delta variant. And even in Canada, we are now at a point where more than 60% of the cases that we are seeing are Delta variant. Overall, by country data, Germany, UK, 100% of the cases are Delta variant, whereas the other countries are anywhere between 80 to 90% and increasing in their proportion with the Delta variant, which is the more transmissible strain than the previous strains. Looking at the data and how it translates into hospitalization. Hospitalization is on the rise in all the countries, whether we're talking about Spain, US, UK, and France, and Italy. So Canada hasn't seen the hospitalization increase, but with the recent increase in the cases, there may be some delay in terms of when these people will end up in getting hospitalized. So something that we can anticipate in the coming days, and which is another reminder that still we have time to get ourselves protected and take the right approach to prevent these cases in our country. So in Ontario, as we are seeing that the overall we are seeing a slight increase in the number of cases, with the province reporting more than 200 cases in the last few days, and in the last 7 days average for Ontario is about 198 cases a day, which is again is an increase from last week and showing the trend that the numbers are increasing in the province too. Our local data also seeing an increase. We have reported 20 cases yesterday. We reported 20 cases today. And overall, our 7-day average is 6.7 cases per day. And this is almost doubled from where we were last week. Just a close-up of our data from July onwards of our daily cases. We are seeing an increase of cases since late July, early August. Looking at our week-over-week incidence rate per 100,000 population for completed week, our most completed recent week case rate is 8.3 cases per 100,000 population. And again, this is an increase from the last week when it was 5.1 cases per 100,000 population. Looking at just the past 7 days, our rate is further increased to 12.7 cases per 100,000 population. And again, last week it was at 5.6 cases per 100,000 population. Overall, the trend, as we can see in Windsor-Essex, is on the rise, whereas the province and the Southwestern Ontario region is still stabilized, not showing an indicator that it's going up, but relatively stable. Looking at our wastewater surveillance data, overall the numbers continue to remain low, but we are starting to see a slight increase in the wastewater data, which is something that we are also seeing in the number of cases that are being reported every day. From a person positivity perspective, our person positivity is also on the rise. The most recent week that ended on July 31, our person positivity was 1.2%. This is an increase from last week. Just looking at the most recent 7 days data, based on that, we are at 8th highest person positivity in Ontario, and currently sitting at 1.1%, which is slightly higher from last week when it was 0.3%. And we are above the provincial average, which is also at 1.1%. From the distribution of age, not much difference. We are seeing the person positivity pretty much similar in all of the age band, a little higher person positivity in the younger band, but overall, not a lot difference. From the case rate perspective, Windsor-Essex continues to have the 4th highest case rates in Ontario. And drilling it down further into the municipality, and again, this data is just from July to present, where we are seeing that the municipality of Kingsville had the highest case rates in our region, followed by the city of Windsor and LaSalle and the other municipalities. From a case distribution perspective, 60% of the cases are currently from July to 6th were in city of Windsor, followed by Kingsville at 10%, and then the rest of the municipality pretty much closer to each other. Just in the last 7 days, a slightly different picture. The overall cases in Windsor is at 52%. Whereas the town of LaSalle, 16% of the cases came from there, followed by Lakeshore at 11%, Kingsville at 8%, and then the rest of the municipality at a slightly lower rate. So who's getting infected mainly? It's the younger population again. As we can see, 23% of the cases in the last 2 weeks came in the population between 0 to 19, followed by 30 to 39, and then 20 to 29. So the younger age band, where we know that the vaccination rate is slightly lower than the older age group, that's where a majority of these cases are coming from. From an exposure perspective, we continue to see the exposure coming in from everywhere, including travel-related cases. We are seeing quite regularly the cases coming in as a result of travel. From an acquisition source perspective, almost 1/3 of the cases, slightly over 1/3 of the cases are coming from community transmission, still where people don't know where they acquired the disease, followed by the household contacts and close contacts, and 15% of the cases came from a travel-related since July. COVID-19 hospitalization is still stable on the decline. ICU continues to stay in the decline, but we know that both these indicators are lagging indicator, meaning that once cases start to increase, we do not see the result immediately, but we see the result after a few weeks of the initial case increase. So whatever case increase we are seeing, we may see the impact of these cases in the hospital and hospitalization and ICU at least 2 to 3 weeks from now. From a case doubling time period, we can see that the doubling time is decreasing. And just as a context, when the case doubling time is decreasing, that means it's bad, meaning that it's taking less days for the cases to double in number. And if the doubling time is increasing, that means that's a good sign and things are improving. But overall, in Ontario, in Windsor-Essex, in Canada, the case doubling time is decreasing, which is an indicator that we are heading towards another surge, and something that we still have time to make sure that we take all the public health measures, including getting the vaccine, fully vaccinated, to prevent any further cases and hospitalization in our communities. So our median R not effective is increasing as well, and it's currently sitting at 2.05, and this is higher from last week where we were at 1.41. Our R naught has not been above 2 since June of 2020. So this is pretty significant from that perspective, but also on the other hand, the R effective or R not effective fluctuation happens quite a lot when the case counts are low. But with the recent increases, the case counts are enough to give us some indicator of where these median reproductive rate is sitting, and which is also evident in the last 2 days when we reported 20 cases in both days. So looking at our vaccine status, Canada continues to lead the developed countries with the majority of the people, or most of the people, or highest number of people who have received at least 1 dose of COVID-19 vaccine in the world. And when it comes to the share of the population that are fully vaccinated against COVID-19, Canada already surpassed UK and is on track to exceed Israel in about a week's time, with the highest number of population that are fully vaccinated against COVID-19. From a day over day administration, vaccine doses that are administered in Windsor-Essex, we continue to see some first doses, but the number of second doses are declining at a rapid rate, and which is also reflected in this graph, which is basically just showing that we are administering just over 1,300 doses daily compared to last week when we were administering at least 2,100 doses a day. And this is a huge decrease, about 37% decline from where we were last week. First dose, second dose, it's again, the second dose are declining much more rapidly than the first dose, but first dose is still, it's on the decline as well, and there are a lot of people who are in the eligible category that are still not vaccinated, and we strongly encourage those people to get their vaccine. This graph showing just the cumulative doses administered, and as we can see, even for the second dose, it's starting to show some plateauing, which is not a good sign because we still have a long way to go to fully protect our residents against COVID. Breaking it down by age group, overall our coverage, and this includes everyone, including those who are ineligible to receive the vaccine, 67%. Among those who are 12 and older that are eligible to receive the vaccine, our coverage rate is 76.3%. And then when we're just strictly talking about the adults, it's 77.9%, or 78% of our adults that have received at least one dose of the vaccine. And the gradient, as we can see, the older the age group, the higher the vaccine coverage rate. And this graph basically just breaks it down, the plateauing effect in the younger age group, if whether they are still, the demand is still there or not. This graph basically just shows the fully vaccinated people by age group, and overall it's 59.2%. In adults, it's 69.6%, with less and less number of young adults that are fully vaccinated, including 12 to 17 and 18 to 29. Those are the youngest, those are the lowest fully vaccinated residents in Windsor-Essex. Again, same graph, just showing some the demand and how it's plateauing in the younger age group, and clearly a lot of room for improvement. This graph basically just shows down the first and second dose coverage rate, and as we can see, the first dose coverage rate is not the same as the second dose coverage rate. There's a lot of room for improvement, even for the second dose, to increase the number of people to get themselves fully vaccinated. When it comes to the hotspot, overall, our hotspot coverage rate is slightly less than the overall coverage, with some hotspots such as N9A and 8X continues to show that the coverage rate is lower. And with the partnership from the city, the CMHA, through the high priority community, we are continuing to roll out vaccination in these areas, offering vaccine and removing any barriers for them to get the vaccine. This is the same data, but for fully vaccinated people, similar picture, slightly less coverage in the hotspot area compared to the overall, and the same postal code regions with lower coverage rate than the rest. So overall, since we started the vaccination, when with the fully vaccinated people, the overall case rates have gone down. But with the reopening, we are starting to see some increase in the cases, which is definitely something that we need to be mindful of, and highlighting the importance of maintaining the public health measures and getting fully vaccinated. We were obviously, when the vaccination started, we were one of the leading health unit to have the highest coverage rate earlier on in the pandemic, but we are sliding down quickly, and right now we are in the bottom half of the health unit that have received at least one doses. And then when we're talking about the fully vaccinated, we are further down below among all of the health unit, much below the provincial average at this time. So this graph is a new graph that I put together today, and this is provincial data. This is not local data. And this basically just shows the confirmed post-vaccination cases of COVID-19 starting from December 14, 2020 to July 24th, which is a couple of weeks behind. And it just breaks down the data on the cases and the proportion of cases that we are seeing at the provincial level among those who are not yet vaccinated versus those who are partially vaccinated versus those who are fully vaccinated. And the fully vaccinated people are in the blue bar, and we can see that the asymptomatic cases, it's less than 10% among the fully vaccinated people, and among the symptomatic cases, we are seeing less than 3.9 or 4% of the cases that are fully vaccinated and symptomatic. So clearly showing the benefit of the vaccination and how it is affecting the entire province. So for people who continue to show up at the hospitals and in the other places, they are mainly the one who are unvaccinated. Anywhere between 80 to 90% of the cases that we are seeing in the province are among those who are unvaccinated. And among those who are fully vaccinated, the severity of the disease is very, very low, and most of them just recover without even knowing. So this is another provincial data showing the proportion of confirmed COVID-19 cases, hospitalizations, and death in the province. And overall, as we can see, among everyone, the unvaccinated cases contributing almost like 95% of the cases in the province, and some cases in the partially vaccinated case, and very limited cases in the fully vaccinated, or what we call as breakthrough cases. So we can see that the hospitalization, death, and even just the case counts among those who are fully vaccinated is almost negligible, and highlighting that why we need to get the everyone with 2 doses of the vaccine to prevent any hospitalization and deaths in our region. And we definitely don't want to see the ongoing transmission of cases, do not want to allow the virus to mutate further or get into another different strain which may not be responsive to the vaccine. So now is the time. We're already starting to see cases increasing in our community, and it is absolutely critical, and I cannot emphasize it much more. Just to look at this graph, look at the data where it is showing and how important it is for people to get fully vaccinated to protect themselves and protect their loved ones. So in summary, overall, our case rates have increased again this week, almost doubled from where we were last week. Our hospitalization still remains low, but as I mentioned, it is a lagging indicator, and we may see the impact 2 weeks from now, 2 to 3 weeks from now, in the hospitalization and ICU utilization. First dose coverage rate for all Windsor-Essex is at 67%, and this includes anyone who's whether they're eligible or ineligible at this time. Second dose coverage rate increased slightly as well, 59.2%, but overall our number of second doses and first doses are decreasing in our community. From a monitoring indicator perspective, most recent completed weekly case rate is 8.3 cases per 100,000 population, but just in the last 7 days, it's at 12.7 cases per 100,000 population. Our person positivity has increased, our effective has increased, and our outbreak has increased as well. So right now we are sitting at 3 outbreaks. We have roughly 78% of Windsor-Essex that have received at least 1 dose of the vaccine, falling behind the provincial average, and among the bottom half of the health unit that have received at least 1 dose, and almost 70% of Windsor-Essex that are fully vaccinated. And again, it's even further below the provincial average in the 25th percentile at this time, with our residents that are fully vaccinated. Thank you.
Kim McAlpin, call switchboard, please. Kim, call switchboard.
We'll now take questions from the media. Is there any questions from TV?
Yes, good morning. I'm just wondering, given that the trends are increasing and step 3 is supposed to be wrapping up according to the province, would you be comfortable with the loosening of restrictions even further?
Well, at this time, I think the best thing should be to see how the cases continues to unfold. It is unfortunate that when things are closed, there are restrictions, which is the right thing to do. But with the loosening of the restriction, it almost feels that people forgot that COVID still exists, and there are people who are unvaccinated, and quite a few of them. So when we're talking about 78% coverage, so in adults, there are at least 22% who have not even received any dose of the vaccine. And we're talking just about the adults, which is pretty a large number. And for the community of our size, we are talking about roughly 50 to 60,000 people that have not received a single dose of the vaccine. So when things are opening up, so for example, if you're going to a restaurant, if you're going to any place that does not require you to wear the mask, of course, when eating or doing other activities, you will be sitting among people who are either unvaccinated or vaccinated, and increasing your chances to contract the disease. The trend we are seeing locally is at least the similar trend. 75 to 80% of the cases that we are seeing is almost in everyone who's unvaccinated, and few who are vaccinated, but in a setting where they think that they don't have to take any precaution. So it is a good reminder that we need to understand that the pandemic is still there. Your risk of contracting COVID would still be there, and if you are among the less than 5% of the category who may develop the severe disease, you are at risk. So any activity that you are engaging, it increases your risk. Any further loosening of the restriction would open up more opportunities for people to contract COVID. So I think we should be really careful in how quickly we are opening things up to make sure that we allow our community to adapt to it, and also to increase the vaccination rate, which is absolutely critical to protect our residents. So at this time, short answer, I think we should wait and see instead of further loosening the restrictions at this time.
And would you consider adding even more restrictions if the trend does continue in the wrong direction?
Well, we have always taken that step in the best interest of our community. So we'll have to reevaluate. We'll have to look at what the province is doing, and we'll have to look at what our community needs and take appropriate actions.
Okay, thank you.
Any questions from CFTV?
Yes, good morning. You were mentioning this morning about children receiving other vaccines other than the COVID vaccines. They're available to them if they need it. What is the timeline between these other vaccines, the meningococcal and a few others that I can't remember that you mentioned, and the COVID vac? Like, can one get the COVID vac and these other vaccines at the same time, or is there a waiting period?
So the science is evolving in that area, and there are differing recommendations at this time with no clarity in terms of the interval for that. We are going with the earlier recommendation in the absence of any clear direction is there has to be at least 28 days interval after receiving a COVID vaccine before an individual can receive any other vaccine type.
Okay, and one more question for you. What advice can you offer to parents of younger children that are unable to take this vaccine with the opening up of schools and going back to school? What kind of advice can you offer these parents?
Well, I think the most important thing I would say is to get yourself vaccinated because you are eligible to receive the vaccine. Talk to other parents and get them vaccinated, because it's absolutely critical that if your child is attending a classroom with other children, the majority of the families of those children, if they are vaccinated, the likelihood of any spread in the classroom would be low. So it's not only your job to get yourself vaccinated to protect yourself and to protect your own kid, but also in the event if something happens, then it's still you are trying to your best to break the chain of transmission. When majority of the parents are vaccinated, the likelihood that they're passing it on to their children will be low and will not result in any further transmission in the school system. So get yourself vaccinated, talk to other parents, talk to your other families, get them all vaccinated, and that's the best way we can do to protect those who cannot receive the vaccine by taking the vaccine.
Thank you very much.
Any questions from CBC?
Yes, good morning. We know that youth are being asked which school they attend when they get their COVID-19 shots, and that information is being collected by the province. Is that information available to the health unit? Are there plans to share that data by school with the school boards or with the public? And if not, can you explain why?
So right now we have requested the province to share that data and make it available for us so we can share it more publicly. There are some challenges in terms of how the data is captured and how it can or cannot be reported, but we are trying to work through all of those logistics to make it available for our parents and also for our community as best as possible.
Thank you. You mentioned that the rise in cases is something we need to be mindful of. I think you've also mentioned in the past that you expected a bit of an increase after restrictions were loosened. So I'm wondering whether the most recent increase, is that in line with your expectations, or is the situation worse than you thought it might be?
So my initial reaction was that it's worse than where I would have expected. So right now, as I said, the last 7 days, our case rate is at 12.7, and I was expecting that maybe even in September we may see case rates up to 10 per or more than 10 per 100,000 population. And this is just the beginning of August, and we are already at 12.7 cases. And again, it's not that it was unexpected, but I think, and again, even from my personal experiences, what I'm looking at people are not following any public health measures, like, you know, physical distancing. People don't care. People are hugging each other, even people they don't know. You don't know what kind of risk that you are putting yourself into. It's opening doesn't necessarily mean that the risk has gone down or risk has decreased. You can only be confident in terms of who you're meeting if you're aware that everyone that you're interacting with are fully vaccinated, or if they do not have any high risk exposure. With these type of setting, it's almost impossible to tell. So what are we doing as a community to even factor that in and make appropriate decisions? So it is unfortunate that the cases are increasing very quickly. And we have seen it in Windsor-Essex that how quickly things can change. We did really, really well last year in September, October, when we had very low cases compared to the provincial average. Came in Halloween, things just completely went into opposite direction. We have had a good run in the last few months. When the entire province was going through the third wave, we avoided that third wave. And maybe some people are thinking that we have come out of it and we don't have to worry about it. But this is not true. This is already reflected, it's starting to show in our numbers, and it can continue to get worse if we continue to follow the same pattern. We have to change that. We have to understand that, yes, things are opening up. Yes, we can engage in certain activities, but the way we need to engage in certain activities, it cannot be the same before the pandemic that we used to do. It has to be different, it has to be safe, it has to be more careful because every time when more people are coming in, the risk is increased, and the risk will continue to increase in our community unless we change the course.
Thank you. Any questions from Blackburn?
Yes, good morning. I know that some of this data is delayed, so I'm not sure if you can answer this, but according to the data on the website, the most prominent variant here is still the Alpha variant. Are these new cases, are we seeing more of the Delta variant here now?
Yeah, so just as a context, what I can tell you that a week from before, we only had 14 cases of Delta, but as of yesterday, we had 34 cases of Delta variant. So almost like double the number already we are seeing. So, and some of the outbreaks that we are currently active is as a result of Delta variant. So we are experiencing that, and we're slightly delayed in terms of what the Delta surge looks like. But we are getting there, and it will continue to get worse, and people need to be mindful. This is a much more transmissible strain, and we need to be fully vaccinated to protect ourselves and to break the chain of transmission.
And just on the vaccine front, I haven't seen any data on the people who were vaccinated outside of the province. Is that slow to come in? Are people not registering their vaccine?
So we are getting the number, and that number is already getting uploaded into COVAX system. There are some delays and a slow increase in the number of in the number of reports that we are receiving. But our team is diligently uploading that, and that data is also included in the overall vaccine coverage rate as we are reporting right now.
Thank you.
Any questions from Windsor Star?
Yes, good morning, Doctor. Good morning, Nicole. Doctor, you did mention the workplace outbreaks, and the Delta variant is active at least 2 of them based on what's on the website right now. How many cases roughly are we seeing coming out of those workplaces? And are workplace closures, dismissals happening? Are they on the table?
Of course, they are on the table. We already have a Section 22 order, which basically just lets the employer know that if the case count increased to more than 5 cases, there could be potential consideration of workplace closure. At this time, I think the maximum number of cases in these workplaces is 5. It hasn't exceeded 5, but overall, our team is working very diligently with all these workplaces to contain the outbreak and to prevent any further transmission. So far, it is contained. I am not concerned that it will continue to get worse, but obviously the risk is there. If the risk changes, we'll have to make some decision, but at this time, those are well managed, and the ongoing risk is relatively low.
And as for vaccination, we saw in the last 2 weeks a number of pop-up clinics with walk-in availabilities held at schools. Are there any other plans in the works right now to hold different, more unique opportunities to push to get more people vaccinated?
Yeah, thanks for the question. So we are continuing to meet weekly with our community partners, and so you'll continue to see more mobile clinics on a weekly basis. We are using our data, so we are analyzing where our rates of vaccination are lowest, whether it's an overall vaccination rate, and we are also starting to look at our data by age group and work with our partners to see how best to target mobile opportunities, as well, again, as work with the communities to try to see how we can encourage people to get their vaccination and attend either that site or a pharmacy or their doctor or one of our mass vaccination clinics. We are, I'll probably have more information going forward. Our team internally is just looking at, basically every opportunity we can think of to get out and bring vaccination into the community. So again, it'll always be data informed, looking at the areas where we see the lowest uptake, but we are looking at sort of more innovative approaches or other venues outside of what we've been doing. So for example, potentially workplaces, going directly to workplaces. Those are certainly will be in schools when schools start. So those are just some of the things that we're contemplating right now and just working on our plans.
And can you comment on the success of the in-school pop-up clinics? Did you have the turnout that you expected?
No, so we didn't. We had capacity to do a lot more than we actually saw. But I think anybody coming for their first dose certainly is a success. So any little bit that we can chip away, and anytime we see anyone showing up for their first dose, that's a huge success. And certainly anyone we see fully vaccinated is a huge success. So, as much as we were hoping it would be a much larger crowd, I think we had a capacity up to 500 for most of those events, and we, in most cases saw less than 100. So it wasn't, as big as we thought it would be, but I think, again, any person receiving their vaccine is a success. So would we like to see more people? Yes, but, we were really happy that we saw people.
Thank you.
Any questions from AM 800?
Dr. Ahmed, do you want the vaccination to be mandatory?
Sorry, I think you cut out a little bit, Rob.
Oh, sorry. I was just wondering, do you want the vaccination to be mandatory?
Well, I think we have to look at all the policy levers, and we do have the Immunization of School Peoples Act for the school-aged children that requires a number of vaccine that either they get the vaccine or to provide a proof of exemption. So similarly, there could be a number of other policy levers that can be looked at. The hospital, I think Windsor Regional Hospital did a great job in terms of ensuring the safety of people who are visiting hospital by requiring employees either they get vaccinated or undergo daily testing. It is critical because we're talking about a large number of people who did the right thing, who ensured that they followed public health measures. They got the vaccine when it was available for them, and it's unfair for many of them to attend to various activities where there are people who just by choice do not want to get the vaccine, and putting everyone at risk. So there has to be some good dialogue in the community in terms of how we as a community put some of these values in our decision making. If it's something that we are talking about, we have done with everyone, each one of us have gone through number of challenges, number of sacrifices that we all have given to get to where we are right now. And we know we want to open up, we want to socialize, we want to do everything that we want to do. How do we do it safely, and how do we still respect everyone's personal choices? But sometimes these choices also put other people at risk. Are we willing to give that choice and put others at risk? This is something I think that we need to all talk about, and we should look at what is at stake and what is the best way to move forward. So definitely we have to look at some of the policy levers to see how we can continue to do the great work that we are doing in keeping our communities safe, protecting our residents, saving lives, and everyone has done many sacrifices, and it's time that we have to ask this question and do the right thing, what is needed for our community.
You mentioned in your presentation the number of doses last week was about 2,100 and about 1,300 this week. I'm not sure if I missed it. Is that for second doses only, or that's combined, first and second?
That is combined, Rob.
Are you worried that trend at 700 cases right there, or 800 cases, sorry, or 800 people, are you worried that trend could continue next week and beyond?
Well, I think we are mostly our people who were motivated to receive the vaccine. They have received the vaccine, and then we have people who are not receiving the vaccine, either based on the misinformation or based on some of the choices that they want to make for themselves. So I think that's definitely we are hitting a difficult population. And in order to get them compliant, I think there needs to be other options that should be on the table to motivate them. And there are some people who are just basically, I don't want to use the word in a negative notion, but they don't have that sense of urgency that they need the vaccine. They are engaged in activities which is more important to them, such as going on vacation or enjoying some of the other activities with other people, and vaccination is not at the top of their mind. So we want to target those individuals and let them know the risk that if they continue to do that, how they will be at an increased risk of contracting COVID, and how they can still do all of those things when they're fully vaccinated. So I think that's one target group. The other target group who are misinformed, we want to make sure that they get the right information. There's tons and tons of misinformation out there, and people have all sort of conspiracy theory about these vaccination. Just imagine, and again, I just don't use this analogy lightly. Just imagine, majority of your healthcare professionals are vaccinated. Almost 90% of them are vaccinated, at least in our area, and they understand science, they understand medicine, they understand the benefit of vaccination. So they have gone through all of that and got the vaccine. You have 80%, almost 78% of the people who have received at least one dose of the vaccine. And we're talking about people who are fairly well educated, and especially in the content area, that they have received the vaccine. And they have opted to receive the vaccine without any pressure. And then you have all this misinformation that talks about people, that talks about, picking information from internet, listening to some scientist or some people who claim that they are scientists and they have a title attached to them as doctors, and they talk about all this misinformation on the internet. And who you want to trust on? You want to trust on those people who nobody cares, who haven't done anything that's significant enough to even allow them to give any airtime, compared to all the other scientific community who have gone through all these research and have done everything right, and to do that. So I think that misinformation piece needs to be addressed. And among those who are completely opposed to vaccine, which is in Canada, that number is anywhere between 2 to 4%. But when you're listening to them, people will claim that there's a large number. No, they're not. Like, there's just 2 to 4% of the people who are completely against vaccination. And again, I can just expect that maybe they will change their mind based on the science. And even if they don't, you still have 96% of the people who should be able to receive the vaccine. And we need that in order to move forward. We need that in order to get out of this pandemic. Otherwise, we'll continue to go in this cycle. We'll continue to have waves after waves because of people who are unvaccinated, allowing the virus to circulate, allowing the virus to mutate into something dangerous, which could even make the vaccine ineffective. So it's, I don't know what more I can do to convince those people, but it is absolutely critical that if we really want to move forward, we have to do it. We have to get vaccinated.
And sorry, you mentioned it in one of the questions, I missed it. How many individuals, the estimation, that are not vaccinated in Windsor-Essex right now?
So we said that among adults, the vaccination rate is almost 78% with at least one dose. So that leaves 22% of the adults. So on an estimate, we have 320,000 adults in our community, which translates roughly into 64,000 or more people, 64,000 or more adults that are not vaccinated or that haven't received a single dose of the vaccine.
Okay, thank you very much.
Any further questions from CTV?
No, thank you.
EFTV?
Yes, just one. If a person has one vaccine, they don't have both yet, and this manages it, maybe they thought they weren't going to get the second one because the first one was going to protect them. And now after everything that's been said, the time has been a lot between the first dose and when the second dose should have happened. If they get scared and they decide they want to get that second dose right away, is that going to take effect as a second dose, or is that going to go back to a first dose date?
So based on the vaccine science, obviously delaying the vaccine is it's not necessarily makes the first dose what's the right term that I'm using, ineligible. So you can still get your second dose even if it's delayed, and you don't necessarily have to start the vaccination series. And we'll have to see what the exact duration is. But even if it's 2 months or 3 months that you have received your first dose, you should still receive your second dose. And if it's more than that, then please have a conversation with your healthcare provider. Please reach out to us, and maybe we can provide you with the best advice based on everything that based on all the other information that we need to sort out. But generally speaking, yes, despite the delay, you are eligible to receive the second dose as soon as possible. So don't delay it further.
Wonderful. Thank you so much.
Thank you.
Have a great weekend.
Any further questions from CBC?
Sorry, did you say CBC or CTV?
CBC.
Okay. Yes, I do have just one more. With regard to that recent rise in cases, Dr. Ahmed, can you speak to where they're coming from? Is it outbreaks, community spread? Are we at risk of becoming a hotspot?
So most of the cases, as Nicole reported, are 6 or 7 cases are household contacts. So which is, again, not unusual because we know that Delta spreads very quickly among the household. And some of these households are completely unvaccinated. So we're seeing that spread in the unvaccinated, mainly in the household context. We've already talked about the couple of outbreaks that are workplace outbreak that are linked with the Delta. And the most recent 7 days data that we presented, it does show that the cases are on the rise in Lakeshore and in LaSalle area where these people reside. Yeah, so generally it still is among the household. Most of these exposures are happening in their houses, but also in places that are currently open in step 3. So it's pretty much all over. I cannot pinpoint one particular thing to say that this is our hotspot at this time.
Thank you. Any further questions from Blackburn?
No, thank you.
Maureen, before you, sorry, Jen. So Maureen asked this question about the out-of-province data. So just wanted to say that our team just confirmed that we have received at least 1,500 individuals who have reported that they've received the vaccine out of province and provided the proof of their vaccination, which is currently in the process of uploading into our central database. And as they are uploaded, we are reporting it back daily in our data.
So are you disappointed then that that number maybe is not higher, that we're not, that maybe that is not the reason why we're so far behind the provincial average?
Yeah, I think we know based on our earlier data that we have roughly around 4,000 to 6,000 people that cross border and work in Michigan. And clearly that number is not captured here. I was anticipating at least half of them or more than half of them would provide the proof of vaccination. But hoping that, at some point when they realize that a lot of that travel is dependent on them providing the proof of vaccination, so they may have to provide that proof. So we'll hope, we're still optimistic, and maybe another push to people who are still haven't provided us with the information to please go onto our website and register your vaccination with us. So we can capture that data locally for our own use, but also for a broader system which may be required for crossing the border in the future.
Thank you.
Any further questions from Windsor Star?
No, thank you.
AM 800?
Nicole, I'm going to ask this, but I think I know the answer already. Can you tell us if the person that passed away was vaccinated?
I don't have that information.
Yeah,
But
no.
Dr. Med, it looks like Dr. Med does.
Yeah, so Rob, I did ask my team to look into that. So the person who passed away was unvaccinated.
Sorry, you cut out there.
The person who passed away was unvaccinated.
Thank you. Have a good weekend.
Thank you.
Thank you, everyone.
Thank you.